In today's Modern Parenting, a study from the University of Michigan Medical School says about 1 in 7 children and teens have at least one treatable mental health disorder, but less than half of kids actually get any kind of treatment. Experts say one reason could be because some parents don't know how to tell if their kid needs help. Joining us now is author and psychologist Eileen Kennedy Moore, hopefully going to help us understand what to look for and when to make that decision. Good to have you here, Doctor. Thank you. So what are the signs that parents could be looking for to know whether they really need some outside help?
If the problem seems to be getting worse rather than better, if it's lasting a while, if it's interfering with daily functioning for the child or for the family, because like everybody's on eggshells trying to make sure the kid doesn't get upset, then it would probably be a good idea to talk with a mental health professional.
I think one of the hard parts too for parents, as a parent myself, is talking to your kids and trying to get their input, especially teenagers, right? Trying to, do you need help? And your teen's like, no, everything's fine. How do you open up that conversation and get some honest information from your children?
So just showing up, spending time with them, non-demanding time makes it easier for them to open up, as opposed to, okay, you're home, I'm going to grill you.
Right.
So just spending time together makes it easier for them to have the space to open up. With younger kids, there's one method that I use, which I call feelings cards. Oh. And I'll have the parent and the child list as many feelings as possible. And then we have the child use the cards to describe how they're feeling right now by sorting them into 3 piles. Yes, no, maybe a little bit. And then the parents can go through the yes pile and say, so what is making you feel nervous? And what is making you feel annoyed? It slows the parents down to just listen. It makes it a recognition task for the child instead of a naming these big feelings kind of situation.
That's really good. It's also very practical, right? I could see parents making the cards and doing that with your children. So there are a lot of different kinds of therapy out there, a lot of different places to turn to. How can parents feel more comfortable about the process of finding that help?
So start by talking to your pediatrician, because the pediatricians always know who's good in your area. And then most therapists will do a phone call. What I tell parents is to trust your gut. You want somebody who's going to be a good fit for your child and your family. And the therapist is an expert on psychology in general, but you are the expert on your child and your family. Nobody has logged more hours with your kid than you have. So ask questions like, what percentage of the person's practice deals with your child's age? What role do they see for parents? Because there's a big difference. Some are like, keep the parents out of it. Personally, I think that parents should be very involved, and it should be a very collaborative thing. And also you can ask, how do they generally approach situations like your child's difficulties? It should make sense to you as a parent.
We only have a few more seconds, but I'm curious if there are free or low-cost mental health resources that you might flag.
Absolutely. There are so many things out there. I have a podcast that comes out every week called Kids Ask Dr. Friendtastic, and each episode features an audio-recorded question of a kid about friendship. And then I say something practical and thought-provoking. There's also books and a lot of online resources.
A lot of online resources if you go looking for them, and local resources too. Doctor, thank you so much. Really appreciate you being here.
My pleasure.
Eileen Kennedy Moore. Thanks.